In our Sunrise Live this morning, a number of comments on our KARE 11 Facebook page about this story. A growing list of local governments and employers are making it mandatory for employees to get vaccinated for COVID-19. It comes as the Minnesota Department of Health says a resurgence of COVID is being driven by the Delta variant, which is now responsible for 3 out of every 4 new cases. The VA became the first federal agency to mandate the vaccine for its frontline healthcare workers. And the Mayo Clinic says it will require shots for all employees. That while a group of nearly 60 major medical organizations has issued a joint statement in support of all healthcare and long-term care providers doing the same. We spoke with the CEO of Care Providers of Minnesota, which represents long-term care providers across the state. She says after months of advocating for education and incentives instead of mandates, providers, especially in rural areas, are concerned that staff vaccination rates remain too low.
We have some large organizations that have decided it is time. We have to do right by our families who are asking. Families, when they place loved ones, want to know, is everyone vaccinated? How many are vaccinated?
Care Providers of Minnesota told us their board could formally endorse mandates as soon as today. Sanford Health and Good Samaritan Society are planning to make the vaccine mandatory beginning in September. And the state of California and New York City have announced that public employees will soon be required to get vaccinated or face weekly testing. So it'll be interesting to see if more cities, more healthcare institutions roll this out as well.
Yeah, could this just be the start?
Yeah.
Anytime the word mandate's thrown into something that gets people's backs up.
Get a little excited about it.
For sure. Let's get to Guy for a